Guys, a week has passed by and I wanted to finish the video. Now, in healthcare, I can't give you guys exact charts that I'm prepping because that would be a HIPAA violation. You guys know that, right? So I just wanted to finish the video by saying this. Chart prepping is different for each hospital and it's different for each department. Believe it or not, in 2024, there are still some hospitals that do not use an EMR system. An EMR system is an electronic medical system where you share medical records, files, things like that. A lot of hospitals still use the old school paper trail with the charts, the ones with the three letters for the last name, and then I guess there's two numbers for the year. Sometimes it's the month, sometimes it's the patient's date of birth, the last one. There's all different ways to alphabetize charts, right? So, just to give you guys a little bit of a story, when I used to work years ago, my first job was in neurology, and this was back in 2008. It was paper trail. Paper trail charts are really bad because they get misplaced, and they get lost, and sometimes the papers kind of get rotted in the chart. So like the ink will dry out. Half the times the doctors, when I used to work in neurology, couldn't even read if there was a recommendation like 4 or 5 years ago. They could not read it because it was all ink and the ink dries up. So the electronic medical chart, I remember it was early 2010 was when they were doing an update in the system of putting all the records into the electronic device. And this is actually better because guess what? Once it's scanned, it's there for life. You cannot lose it. You cannot like misplace it. Funny little story, when I used to work in neurology, well, I look at it now as funny because now I'm more mature. And back then, I really didn't see it for myself, which was a bad thing. I used to work for this neurologist, and I would pull out his charts the night before. So I have about like 20 clients, or maybe sometimes maybe 16. I would give him the files, and guess what, guys? Out of the 20 charts, I would get back 15. Sometimes he had to do some workup, or be labs, or scans. Maybe they found an unexpected finding, so he had to call the patient, do recommendations. He never gave me those charts back. And when those patients had to come back, whether it be like a month later or 2 months later, he was blaming me for losing charts. And guess what? I didn't really have a good boss at that time. I'm not ashamed to say it. She was a horrible boss. And not every boss is going to be good. She would never take my side. She would never try to hear from my perspective. She would just write me up. So that's what she did. So moving forward to 2024, with this chart prep, it's all on the EMR. All I have to do is basically look at my doctor's schedule. So let's say she has like 20 patients, right? So, and I try to prep it like at least 2 weeks out before the actual clinic. So all I'm doing is read the last assessment note. An assessment note is basically any recommendation the doctor might have recommended. Follow up in 3 months with labs, CT ski, echo. Sometimes they refer them out to a different clinic. That's pretty much it for chart prepping. I don't know if you guys have any stories on chart prepping. Let me know if maybe your hospital is still using charts. Another thing too, I forgot to mention, if you are a patient on the floor, even though it's 2024, don't be alarmed. A lot of times hospitals, they call them internists, will use paper chart and they use the EMR records. Um, I don't know why they're still using paper charts, but I guess it's different while they're on the floor because those patients, I think, they're just there for temporarily. So I don't know if they discharge these charts afterwards or maybe they scan them into the file. I don't know, but I know that they still use paper trail charts while you are on the floor. So that is pretty much it, guys. I really hope this video sums up chart prepping. What I'm going to say just before I end this video is if you're chart prepping, always take your time. Make sure you have a piece of paper and a pen because you're going to be reading a lot of stuff. So you might want to jot down, like for my doctor, she'll recommend patients do follow-up. So it's my responsibility to make sure that the patient has done the follow-up. And guys, remember this. Even though the doctor had recommended something, it's up to the patient when they want to get that test done. Always cover yourself So if, let's for example, let's say you worked in ophthalmology and the doctor had referred cardiac surgery. Maybe they want them to follow up with their, if they, let's say if they're diabetic, maybe they want to follow up with their nephrologist doctor for check their kidneys, make sure everything's working. Maybe they want them to follow with the primary care doctor. Maybe they want to have some lab work done. If the patient denies the surgery or they deny the lab work, you have to put patient denies. Always cover yourself. Never assume patients want exams, because at the end of the day, they have their rights whether they want to continue the care. They have the rights whether they want to do the follow up. We're there to service them, okay? Don't, because the reason why I say this, because I've worked with other people, they call the patient like, expecting the patient to get the thing done. No, it's their choice. It's their body. It's their health, guys. I hope you guys found this video informative. I try to put as much information. I'm sorry I didn't shoot this video ahead of time, about like a week out. And this is just to end the video. I just want to make sure, just for end the video, that I didn't leave any gaps. I answered any type of questions I would answer. Let's say if I was looking for information on the internet, how to chart prep, I want to put it in a perspective that someone that never worked in the doctor's office before, someone that doesn't even know what chart prep it is. I hope I explained everything very well. And thank you guys for the support. Don't forget to hit that like button, and don't forget to subscribe to my channel. I hope to see you guys next week. And like always, guys, have a wonderful day. Make sure every day you make it a special day. Bye-bye, guys.